Every year, American hospitals admit 38 million patients. With so many people suffering from so many different illnesses, it's easy to see why things don't always go right and how important it is to ensure that they do. Enter the world of high-tech hospitals and the University of Pittsburgh Medical Center's Smart Room. Intelligence starts with a light at the door.
It'll remind the healthcare provider when they enter the room to sanitize their hands to help reduce the rate of transmission of infection in our hospital. Mrs. Mulcairn.
Doctors, nurses, and techs wear pager-like transmitters. When they enter a smart room, their name and job flashes on a monitor the patient can see.
Do I have your permission to display your information on the screen?
And staff can access a patient's charts bedside.
I can't tell you how many times as a physician when I got to a nursing station looking for my patient's chart, it's not there. Somebody else has it. Shady red one.
The screen displays vital signs, medications, and allergies.
We who work in hospitals know how common it is to make medication errors. If you see a medication up there that you're not taking or that the dose is wrong, you can immediately tell me and we can fix it.
It even reminds patients to ask for help getting out of bed if they're at risk for falling.
So it looks like things are looking good and you're okay to go home.
Sounds good.
Those are the ones he's controlling at the console.
Breakthroughs in robotic surgery mean smaller incisions and quicker recovery.
Run. I don't have an R.
Her fever would go up to like 105, and she would just go into a seizure.
Kayla Umana suffers from an obstruction of the urinary tract called hydronephrosis, which causes chronic kidney infections.
The doctor said she might outgrow it.
But she didn't, and so Kayla needed surgery. The Da Vinci robot helped doctors in Las Vegas operate more precisely on her small body. They move the robot's arms with a controller, using a telescopic lens to guide them.
We would require about a 5-inch incision in the abdomen. Now the surgery is done using 2 small incisions, about a dime each in size, and 1 small incision in the belly button.
She was up walking the next day.
Researchers are now developing robots that can operate on a beating heart and even correct problems while a baby is still in its mother's womb. Training doctors to do high-tech surgery can be costly. But if you have a son or daughter who's a whiz on the Wii, they may have a head start.
This isn't exactly what I pictured when I thought of medical school.
Biomedical researchers at Arizona State University had a theory that hand movements used to play Wii are very similar to those used in laparoscopic surgery.
We actually had people play a bunch of Nintendo Wii games, and we actually had them wear data gloves that can actually measure their hand movements, and we can actually see the similarity in hand movements between one game and laparoscopic probe.
With a few adjustments, Wii accessories were turned into surgical simulation tools.
We took the golf club out and we actually put a laparoscopic probe onto it.
This does really help. It kind of coordinates your hand movements and gets you prepared to go in the operating room and perform laparoscopic surgery.
Traditional surgical training simulators cost hundreds of thousands of dollars. The Wii version, just a few hundred. A pilot study found by playing the specially adapted Wii, residents' skills improved by 48%.
This gives us a much less costly way to train on these fine motor skills that the surgeons employ during surgery.
From training to surgery to bedside, high-tech tools help doctors put patients on the road to recovery.